Hello, Dr. Physical Therapist, and welcome to my channel. If you didn't see any video for me before, so I would like to introduce myself for you briefly. My name is Dr. Mohamed Kamel. I work as Associate Professor of Physical Therapy in one of the universities of United States, and I have a PhD in biomedical science from University of Nottingham in United Kingdom. I am also a licensed physical therapist in a number of states in United States of America and in United Kingdom and in Egypt. I'm teaching for preparation for license exam since 2017, and I have many students who passed these license exam with me. So if you are interested, please follow me on YouTube, subscribe, and also ask about the special course which I'm teaching for preparation for license. So let's see what's today topic or question about. The question saying a patient who reports double vision has ptosis, lateral strabismus, and a dilated pupil in the left eye. Which of the following cranial nerve test results is most likely to be abnormal? Number one, pupillary light reflex. Number two, facial muscle strength. Number three, jaw jerk reflex. Number four, pain sensation on the face. So we have here four options, two reflexes mainly, one talking about muscle strength of the facial muscles, and one talking about sensation. And in order to answer this type of question, you need to have a good background of the different nerve supply and the cranial nerves which are supplying the face. Which one is sensory, which one is motor, and about the reflexes, what is the afferent, what is the efferent. Okay, so let's walk through this question together. Now we have a patient reports double vision. We have another term for that called diplopia, and presents with the following: ptosis, which is a dropping of the eyelid; lateral strabismus, means that eye turned outward; and dilated pupil in the left eye. Okay, so what is the correct answer? Let me give you the correct answer and explain why. This is pupillary light reflex. Okay, so these symptoms, which are ptosis, lateral strabismus, and pupil dilation, these are classic signs of lesion involving the oculomotor nerve. And as we all know that the oculomotor nerve is the cranial nerve number three, cranial nerve number three, because this nerve mainly supplying the eye muscles, and at the same time, it is part of the pupillary light reflex. It is the efferent for pupillary light reflex, basically. So cranial nerve 3 fits the finding in for this patient. Why? Ptosis means paralysis of levator palpebrae superioris, or which is responsible for elevation of the upper eyelid. So if there is paralysis of this muscle, there will be dropping of, eyelid, or what we call ptosis. Lateral strabismus, you know that cranial nerve number 6, which is the abducent nerve, moves the eye outward. Okay, so lateral strabismus unopposes the action of lateral rectus, and this muscle is supplied by cranial nerve number 6, or the abducent nerve, and also the superior oblique muscle, which is supplied by cranial nerve number 4, which is the trochlear nerve. So the affected eye will drift outward and downward, outward and downward. Finally, dilated pupil, which is a loss of the parasympathetic fibers that constricts the pupil. Okay, and this normally happens through Edinger Westphal nucleus, and then the ciliary ganglion, then the sphincter pupillae, So this pathway, so we have a loss of the parasympathetic fiber innervation as well, which result in this dilated pupil situation. And this diplopia or double vision due to the misalignment of the eyes due to paralysis of several muscles, as you can see, and the unopposed action of working and unworking muscles, or working and paralyzed muscle. Okay. This is a pupillary light reflex. For any reflex, we have a receptor, and and the stimulus, which is light shown in the eye, using torch or something like that. And we have an afferent, which is cranial nerve number 2, which is the optic nerve, and efferent, which is cranial nerve number 3, or the oculomotor nerve. Okay, so mainly like any reflex, we have the components of any reflex here. Okay, so what is the answer? Again, pupillary light reflex, and which cranial nerve is affected? Nerve number 3, oculomotor nerve. Afferent is cranial nerve number 2, which is the optic nerve, which will sense light, okay, on the pupil. And then the afferent limb is cranial nerve number 3, which is supposed to constrict the pupil as an efferent. If the cranial nerve number 3 is damaged, if the efferent limb is affected, there will be no constriction of the affected pupil when the light is shown. Okay, so the direct response is lost, and then the consensual response, which is constriction of the opposite pupil, because when we show light into one eye, should be a constriction of the pupil of the same eye, and also the other eye. Both eyes should have constriction of the pupil. Okay, so if we have an injury on one side, this will lead to loss of the direct response, which is constriction of the pupil. Like if you are showing the light into the right eye, there will be dilation or loss of constriction of pupil on the right side, but the consensual response on the left eye will remain intact. Okay, so constriction of the opposite pupil remains intact. So this abnormality in pupillary light reflex is mainly due to injury or abnormality within the afferent or the oculomotor nerve. Okay, so this was the correct response. How about the other options, or the incorrect options? Facial muscle strength. Okay, which cranial nerve is supplying facial muscles? Cranial nerve number 7, or facial nerve. Okay, so if there is weakness, or will show like facial droop, loss of blinking, impaired taste, where from the anterior two-thirds of tongue. So because the facial nerve is supplying or taking taste sensation from the anterior two-thirds of the tongue. Okay, but we will not have any ptosis or eye deviation. Okay, so cranial nerve number 7, or the facial nerve, has no role in supplying extraocular movements or pupil control, and which is a function mainly of the cranial nerve number 3, or oculomotor nerve. So that's why this is not the correct answer. Jaw reflex, jaw jerk reflex. Which cranial nerve is responsible for that? Cranial nerve number 5, which is a huge cranial nerve, trigeminal nerve. Okay, and it has different branches, but this is mainly the motor branch, or V3, or number 3, branch number 3 of the trigeminal nerve. So what is the jaw jerk, or they call it masseter reflex? We have afferent limb, which is cranial nerve number 5, sensory component, and efferent limb, which is cranial nerve also number 5, or trigeminal nerve motor component. So this is mainly related to the muscles of mastications, not ocular muscles, and unrelated to the signs and symptoms for our patient today. So this is cranial nerve number 5 is not the correct answer. Last one. pain sensation on the face. Which cranial nerve is conveying pain sensation from the face? It is cranial nerve number 5 or trigeminal nerve. Sensory component. Okay, so if there is any problem, there will be facial numbness, but there will be no ptosis, diplopia, or pupillary dilation. Okay, so here, to summarize, pupillary light reflex is a reflex which has an afferent, which is cranial nerve number 2, optic nerve, efferent, cranial nerve number 3, which is the oculomotor, which is the affected one here. And this will be abnormal, and it will affect the constriction of pupil, so you will have dilated pupil and other signs and symptoms, diplopia and other ones. Cranial nerve number 7, facial muscle strength mainly, and control face, not eye muscles. Cranial nerve number 3, I'm sorry, number 5, or trigeminal nerve, is responsible for the jaw jerk reflex, sensory and motor component, and this is mainly related to the muscles of mastication, not ocular muscles. And finally, pain sensation on the face, cranial nerve number 5 again, and sensory component, so it is not related to the oculomotor function. Okay, so in summary, the cranial nerve will have different functions. So cranial nerve involvement, like in oculomotor nerve, this nerve mainly innervate the medial rectus, and if this muscle is weak, would lead to lateral strabismus. Also, the oculomotor nerve is mediating papillary constriction, and the lesion would cause papillary or dilation. I mean, it is a pupillary dilation, sorry. The ptosis is caused by loss of innervation to levator palpebrae superioris muscle, which is responsible for elevation of the eyelid, so there will be ptosis. Double vision, inability to move the eyeball normally, because 4 of the 6 ocular muscles controlling the eye are supplied by the oculomotor nerve, and they will be affected. Okay, also, as I told you, oculomotor nerve is the efferent for the pupillary light reflex. However, the facial nerve is not the correct answer because it is responsible for facial expression. Trigeminal nerve is responsible or mediating jaw jerk reflex, and pain sensation of the face is also mediated by the trigeminal nerve. So this was the answer for our question today. Please join me, subscribe, so you will have any new video which I will post in on this YouTube channel. And if you would like to join our course for the preparation of the PT license exam, please send me, WhatsApp message on one of these numbers, and I will reply to you with the details, including the times, fees, and everything. Okay. Also, for those who are interested to apply for the transitional DPT program from University of Montana in United States, please also send me a message to these numbers, and I will reply to you with the requirements to join the program. Good luck, and thank you for watching this video, and see you soon in another content.